every way. Enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Some women experience health challenges during pregnancy. These challenges can involve the mother's health, the health of the fetus, or both. Even women who were healthy before getting pregnant can experience challenges which may make the pregnancy known as what we call a high-risk pregnancy. Complications of pregnancy include physical and mental conditions that affect the health of the pregnant or postpartum person, the baby, or both. Physical and mental conditions that can lead to complications may start before, during, or after pregnancy. It's very important for anyone who may become pregnant to get health care before, during, and after pregnancy, we're also known as postpartum, to lower the risk of pregnancy complications. The postpartum period begins soon after the delivery of the baby and usually lasts 6 to 8 weeks and ends when the mother's body has nearly returned to its pre-pregnant state. The postpartum period for a woman and her newborn is very important for both short-term and long-term health and well-being. Today on your regular health TV talk show, The Physicians, we'll be discussing the journey of motherhood, navigating pregnancy and postpartum challenges. Stay tuned.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
It's another day with The Physicians, where your health is our business and will always be our business. My name is Dr. Martina Agbemi, your regular anchor on this program. Today we'll be discussing the journey of motherhood, navigating pregnancy and postpartum challenges. In the studio with me is my very cerebral obstetrician and gynecologist. She's no other person than Dr. MODUPE ADEDEJI. She is from the Lagos State University Teaching Hospital. Doctor, you're welcome to our program.
Thank you very much. I'm happy to be here.
Yeah, thank God you finally made it. After so many trials coming after you.
I'm sure you know the life of obstetricians, gynecologists.
I know, but
as soon as you give an appointment and somebody is in labor.
I'm grateful that at least you made it. Yeah. Because there's no way we want to talk about obs and gynae and we don't have people like you on our program. So we're talking about the journey of motherhood, navigating pregnancy, and postpartum challenges. So let's first of all roll. When you talk about postpartum, what is postpartum?
Okay, yes, that's actually the period immediately after the baby placenta comes out. When the life of the baby begins, that means the uterus is empty. And then we give it like 6 weeks before the uterus goes back to near its pregnancy state. I mean, that means the uterus, when it goes back to its near pre-pregnancy state. So all that period takes about 6 weeks. So that's the period. Okay. Delivery, then 6 weeks after. That's postpartum period.
Then, of course, pregnancy.
Yes, then pregnancy
is there a definition of pregnancy?
Yes, obviously. Okay, that's the period when there's conception till the period the woman starts feeling contraction, the cervix starts to change. Okay. So that's the period. Then we have that interval between the pregnancy and the postpartum period, which entails the labor period, the delivery period, the delivery of the baby period, and the delivery of the placenta period. So that plays, though they are short, but they're also very important. And there are reasons for having those periods, because different events, certain events occur at that period.
Okay, that's good. talking about the different periods, right?
Yes,
So we're going to
exactly.
take it from pregnancy up until postpartum.
Okay.
So before, during, and after.
Yeah.
Okay. So starting from pregnancy, we're talking about navigating through pregnancy and postpartum challenges.
Yeah.
So people want to know, what are some of those challenges that are expected that people go through pregnancy and postpartum?
Actually, that's a whole
Lot.
because you are asking me today to discuss my whole textbook on obstetrics.
And the ones that are common. For
Yes,
instance, for
yes.
pregnancy, the first, okay, let's break it down to trimesters. The
Yes.
first trimester, the second trimester, and the third trimester.
Yes.
With
I
that, you
usually
can-
try to explain to my patients that pregnancy is just like a transplant because you know your normal milieu before. That means how you are.
Yeah.
All of a sudden, something has to grow on your inside, as if you are putting something
Okay.
on your inside. And then the body definitely can take, can react, and may reject.
Okay.
You know, so that's the period.
Okay.
And the common rejection period in human should be like about 10 months. I purposely said 10 months because usually we say 9 months. So we count in weeks. So the pregnancy period, we usually don't want it to exceed 40 weeks. We give an allowance of 1 more week. WHO said we should call term 37 weeks to 42 weeks, but we don't allow pregnancy to get to that period. So from the day of conception, it's usually very difficult to pick the day of conception, but we date it from the last menstrual period. And a lot of young people tend to get it confused. They want to count from when they think sexual intercourse occurred, trying to track it on the day, but it's not possible. So we actually use 2 weeks prior to that conception. So that's why we have a period when labor will set in and the delivery period. So the milieu changes when something comes in, definitely. And that entails what happens in the first trimester. Just before you started the program, you just told me now that nausea and vomiting dealt with you.
Yes.
Yes. In
And
fact,
paramesis.
yes. 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 So there's
I had to go on an admission.
Wow.
Because I couldn't take anything.
Yes.
Everything I took always would come out.
Yes.
I looked like somebody from a country I don't want to mention. I was so lean. I was thin.
Yes.
It was horrible.
So that's some of the symptoms. So, you know, we have symptom signs, which we can just put as clinical features that could occur with pregnancy. So first thing first is that just like menstrual pain or menstrual, you know, as soon as you notice the blood, that is when pain and cramps will start. I don't know if we have all noticed that.
Yeah.
So as soon as you notice some form of change, and that is what I mean is that you notice that your cycle is not coming. Come on, I had my menses last month. This is already, I passed another new month. Then as soon as that realization comes, I think it's just psychological. You just notice that there's something wrong. And that's why you start feeling the feeling of pregnancy. And the hormone that is responsible for that, we call it beta-HCG. That is human chorionic gonadotropin.
Okay.
So that's exactly what we test. Evidently, if you've missed your menses, you are sure there was sexual intercourse, the next thing to do is to go for a pregnancy test. And because of that hormone, the pregnancy test will show that, yes, it's positive. But that does not confirm pregnancy. It only suggests pregnancy. So having suspected that you're pregnant, then you have to wait for some time to go for scan. And that scan is very important. That will now identify that, yes, you are pregnant. So we usually say that scan should come up 4 or 5 weeks if you are doing a transvaginal scan, and then 6 weeks and above if you are doing the scan that they put on the abdomen. That is, the probe goes on the abdomen. So as soon as they ascertain that, that means the beta hormones too are going up, and it's actually what is responsible for most of the changes, the nausea, vomiting, the fullness of the breast, the unwell, early morning sickness. You wake up tired and you just don't want to do anything. You put your brush in your mouth, the next thing is whoa, and all that. And then as the day goes by, you are feeling better and all that. So then it comes to the evening. You just notice that you are not okay. Then the mouth, it's you just feel as if you've lost some appetite. In fact, it's not even loss of appetite because you desire to eat. It's just that by the time you're putting it in the mouth, it's just looking metallic or some sorts and all that. Then other things are the body changes that you notice. The breast is full, it may be tender and all that. Though the tummy remains flat. you know, in the first trimester.
Yeah.
So basically, that's most of the things you tend to have. And that's the period that people go to the hospital. Instead of letting the doctor know that I've missed my period, not knowing, you tell the doctor you have malaria.
Okay, so navigating through it, when you have all these kind of things,
yes.
make sure you see your doctor.
Yes,
doctor will see you properly.
definitely.
Okay.
So going to the second trimester, yes, I think because the hormone goes up first trimester and then it starts to plateau from the middle second trimester and then to the third trimester. So you start getting used to it, or the symptoms start getting better. Okay. And then what you start dealing with there now is the real body changes, where you notice your tummy is coming up little by little and all that, and then the urge even for sex also decreases and all of that, and you keep it going. So then even the body system too has a way of changing, because then there's a lot of, the baby has to, a lot of processes that will be going on between your body, the placenta, and the baby, because at that time, the placenta is responsible for nutrients of the baby by means of blood, you know. So these are all the things. The demand is more, and then that's why we usually say you take your supplements and eat well. Okay. I didn't say that well. I should start with eat well, then and supplements. You can actually go through pregnancy with eating well, and taking your fruits.
The folic acid is very important.
Yes, folic acid actually taking care of this the central nervous system, because there are some malformations that can occur there, and that's why we pay attention to that, the nerves, so to say. So we try to put women even before, during pregnancy, and even after, you know, and all that. Then getting to the third trimester is still all about weight. So there are things that we look out for, especially if you are coming into pregnancy with some medical conditions, because those conditions can either get worse, they can be the same, or even get better in the course of pregnancy. So just like that until you fall into labor. You know, I said earlier that you want me to finish my text,
but don't finish your body. This summary is just okay. And you've told us some of the things that will through the first, second, and third trimester. Because we need to keep a deal with our physicians out there. And when we come back, we'll not deal with, we'll go to the postpartum, the things that one should experience during, even birth. We'll talk about birth, how to go through it, then postpartum. Thank you so much. So for our viewers out there, we're back after the short break. We need to hear from you the challenges that come with pregnancy before, during, and after. Back after the short break. Stay tuned.
Okay, so pregnancy in itself is very challenging because you know, in life we go through so much emotions, and now when you're pregnant, there's so much hormones that works in a woman's body when a woman is pregnant, and some of those hormones can actually make the woman sad or happy. Now it depends on people around her, things around her, how she lives and all of that. So if a woman does not have the right people, the right attitude, the right things around her, it might now lead to the woman having postpartum depression when she gives birth. And for some is mild, for some it's worse. So it depends on a lot of factors when a woman is pregnant.
There are a lot of challenges. It comes with a lot of pain. It comes with a lot of discomfort. So it is that stage where a woman would require a whole lot of attention and support, especially from the man. So I think it's best that the man puts in a little bit of energy in supporting the wife at that point. Because like I said earlier, it comes with a lot of discomfort, it comes with a lot of pain. That is the time the woman would need someone right beside her, so not to make it look like she's alone in it, and practically make sure the baby is okay at all
every day and in every way. Enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I find
Diarvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Diarvite from LB Pharma. Diarvite. Love yourself.
Welcome back. If you have just joined us, you're on to your regular health TV talk show, The Physicians, where your health is our business. We've been discussing the journey of motherhood, navigating pregnancy and postpartum challenges. And in the studio, we have Dr. MODUPE ADEDEJI. She is a consultant, obstetrician, and gynecologist from the Lagos State University Teaching Hospital. You're welcome again.
Thank you very much.
So we've talked about the first, second, and third trimester. Let's quickly go to, because we don't have much time, what happens at birth, what is expected, then postpartum, and you round up with the things that should be done.
Okay. Yes. Actually, these are the whole period of pregnancy is very crucial, but I would want to pay attention to the labor and delivery phase, because it's actually so pathetic to have carried pregnancy for, let me use the months so that everybody can follow me, 10 months, and then you have no baby to take home, or probably even the husband is going home alone. You understand what I mean? So that's why it's important that the delivery is supervised. Yes, the things that we bring you to the hospital that you're in labor, we have the signs which we usually tend to educate patients on prior to that time, and that's the pain that comes with it. We usually describe it as a pain that is worse off than menstrual cramps, for those that understand what menstrual cramps is. So the tummy goes, I'm sorry, I'm using the tummy so that I can carry people
along.
But when I say tummy, I mean the uterus. What it's trying to do is actually to push out the baby. And at the same time, the mouth of the womb, that's the cervix, have to open up so that the baby can come up. So there's this strong pain, undescribable. But we say it is the pain, the highest pain of this world. It holds and releases.
The contraction.
And that's the contraction. And that period that it holds, that means that's the period that blood does not get to the baby. You know, so we have to monitor that. So delivery just should happen in the hospital, at least in this part of the world and all that. So that period takes about 12 hours or less. It's not supposed to be more than that. Anything more than that, we're going to be talking about a prolonged labor. So I usually let my patient know that when you go to the hospital to labor in the morning, before night, you should have delivered. And if you go in the night, that means by morning, you should have delivered, because like a 12-hour period.
So the 10 to 12 hours, is this actually supposed to be for every individual that comes, or the first pregnancy?
We just put it like an average.
Okay.
Usually those that are going in second, third time, usually go less.
Okay.
But for the first time, then they may get up to that. So, but we just try to do 12 hours.
I remember, you know what happened, my very first one? I was in labor for a long time, and my colleague in medical school was very, very livid. She told the doctor, what's going on? This woman just came and she's had a baby. My friend is here. She's been here all through the night and no baby. And he says, hello, this is her first pregnancy. She's going to come out. Not up to 10 hours.
That's why we say that the pelvis has not been tested before. So we have to be sure the pelvis passes the test, because if you don't get the delivery done at that phase and you find out there are issues, you know, then that means you have to resort to cesarean section and all that. So that's why it's better done under trained supervision, as in people who are supervising actually are skillful to be able to take that. It's a very important period in a patient's, in a woman's life, because we talk about maternal mortality, which is grievous in that a woman is pregnant, and at the end of the day, because of that pregnancy, she's no more. It's usually very pathetic. Then the delivery period is when you have that very serious urge to push out the baby, which is very, very interesting. The baby actually comes out by itself. So, but we also have to be available to guide.
It's a beautiful sight.
Yes, it is. And then the placenta comes out. And as soon as the placenta comes, we ensure that the whole place is clean. There's no much of bleeding and all that. And the uterus, if immediately starts going back to its normal size gradually, and that's part I just talked about.
Okay, so as an expert, do you believe that if you have a support like your husband being with you in the labor, does it help make it faster, better?
Yeah, not faster, but more maybe probably culpable.
Yeah.
You know, so we even are talking more about that now.
Okay.
Unlike chasing our men to be on the outside.
Okay,
So they
so-
should come and be involved, and then it will help the woman to be able to even.
There was a case. There was a case
better.
that we experienced. This man, the woman was in labor. The husband brought him with tie and said, my wife is in labor. I have to be there. Exactly. I said, it's not time. We said, call me when it's time. The office is not far. When it was time, they brought the man. The man came. Well, as soon as the man saw the baby's head, he collapsed. As soon as he saw the baby's head coming, the man collapsed. They started removing his tie and everything, took him to the recovery room.
Yes.
When he woke up, we said, look at you. You collapsed, you know, that's I
I'm
was very
smiling
impressed.
because I've had that personal experience too before.
Okay, you
I had
see.
a patient like that too. I could see that the woman was so much in pain.
in my
and
own case, my
I just
husband-
wanted to
yeah,
help.
and
So I
that
said
was
the
it.
husband should go in. And the next thing I heard was the man was on the floor. So we had to leave the woman and start to sustain him. Yes. So all these things, it will be helpful.
Yeah.
And the man will be able to cope more if he's also involved in the antenatal care.
Yeah.
I think so. So he didn't prepare for it.
It's good, 'cause
his
my-
utterance then was
yeah.
that he has never seen his wife in that kind of pain before.
My
You
own
know?
case, my husband just said, at the end, I said, he didn't know if he should rejoice because there's a baby or be sad because of the pain I was going through, you know. But at the end of the day, he actually paid off. So now let's move straight to postpartum. What are the things you expect in postpartum?
Yes, especially for first timers, all actually, but more for first timers that have never been there before. There are some interventions that we have to do in course of making the baby come out. Not all women need to have a cut, but most times the cut that we give for the baby to aid the baby to come out is common with first timers. So we have to take care of that place. You know, taking care of that place is so crucial and all that because we tend to mismanage because of
When
people.
you say taking care of that, it's actually the cervix, right?
Yes,
the
vagina,
vagina.
yes, yes.
So they usually a cut.
Call
Because
it
the baby is
episotomy.
coming out, the woman is pushing. Okay, a baby is coming out, the woman is pushing to support and help the woman. You need to make that incision so the baby can come out fast.
Yes,
okay?
exactly.
Oh,
The other thing about the period too is breastfeeding. It actually sounds simple, but for a first timer and even for those others, they're getting to bring your breast feed at every 3 hours, 2 hours thereabouts. It's actually not funny. So the woman had to be taught, know the position and know how to cope with the period of breastfeeding and so much. But the point is just that that period is the time that the woman herself needs the support. It's not the time for the mother-in-law to come around. She's breastfeeding,
She's cooking,
and
doing
then
her
she's
stuff.
cooking and making care of the mother, making sure that the mother-in-law is fine. Rather, the mother-in-law came to actually come in. I'm sorry that I said mother-in-law. Mothers, sorry, to help with the woman.
Thank you. Time is not always our friend. Maybe you want to say final word? Final word of advice?
I'm happy that you asked for this topic because it's very germane, very, very germane. We don't want our women dying for some responsibility that they have to, God-given responsibility. So it's very important that we educate ourselves on this and prepare for the period so that we eventually have a good outcome.
Thank you so much, Doctor.
Thank you.
I really appreciate you. And to our viewers out there, I just want to say thank you again for keeping a date with the physicians. Always. And ensure you keep a date with us again next week. My name still remains Dr. Martina Agbiri. Remember to follow us on our social media platforms, Instagram, Facebook, and YouTube. We have over 250 episodes. Go and binge on them and give us your report. Till next time, stay blessed.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
That I fight you.